If your feet are always cold, your legs feel heavy by the afternoon, you get lightheaded when you stand up, or your toes go numb on long walks. Listen closely. That creeping fatigue in your legs and that fog in your head are not just part of getting older. There is a simple kitchen shelf change many seniors swear by that can help circulation in the legs. And it starts with one oil I recommend far more often than any other: extra virgin olive oil. Today, I'll explain why this oil earns the word secret for so many older adults, how to use it safely, which other oils can support it, and a practical one-week ritual you can try. I'm Dr. Richard Coleman. In my years as a geriatric physician, I've seen the same pattern again and again. People blaming age for symptoms that are actually linked to inflamed, stiff blood vessels. If blood can't flow freely, your legs, feet, and even your brain feel the effect. But the lining of our blood vessels, the endothelium, is responsive. The right dietary fats, used correctly, can soothe inflammation, protect the vessel wall, and help blood reach those tired legs again. Before I name the secret, a quick word about why oils matter. Imagine your arteries as garden hoses. Over decades, a combination of processed fats, sugars, and oxidation acts like rust and sticky residue inside the hose. The lining is no longer slick, it becomes rough and narrow. That lining, the endothelium, is not just passive paper. It controls dilation, inflammation, and how well blood moves. Some fats make that lining worse. Others, taken regularly and correctly, act like a gentle rust remover and a non-stick coating that helps blood glide along. That's where extra virgin olive oil comes in. Extra virgin olive oil, EVO, is the one I call the cornerstone. It's rich in polyphenols, plant compounds that protect lipids from becoming oxidized, and that quiet inflammation in the vessel wall. Think of polyphenols as tiny bodyguards that stop LDL particles, the bad cholesterol bits, from rusting and sticking to the artery wall. Less oxidation means less irritation, and a more flexible artery can widen more easily when your muscles and legs need oxygen. Practically, that translates into warmer feet, less heaviness, and better stamina on walks. How to use EVO? I recommend making it a raw daily habit. A spoonful straight in the morning, drizzled on salads, or used as the finishing oil on vegetables keeps those polyphenols intact. Avoid heating EVO aggressively. Low heat is fine for gentle cooking, but the raw applications preserve the beneficial compounds. In my geriatric practice, no single whole food has been as consistently protective for vascular health as regular, high-quality, extra virgin olive oil used this way. But remember, EVO supports vascular health. It's not a replacement for medications or medical advice. If you take blood thinners or have complex heart disease, check with your doctor before changing your routine. If you're watching and this is resonating, please comment below with your age and country so I can learn who's watching from where. And if you're new here, consider liking and subscribing. I post practical, evidence-aware tips for healthy aging. Most people asking about cold feet or heavy legs are actually experiencing the consequences of chronic vascular inflammation and endothelial dysfunction. Over the years, diets that favor processed vegetable oils, trans fats, and high levels of refined foods contribute to oxidative stress. Oxidative stress is essentially biological wear and tear. Molecules oxidize, proteins and fats become damaged, and the vessel lining loses its smooth character. When the endothelium is inflamed, it signals blood vessels to contract and forms a slightly stickier surface for cholesterol. The result is reduced blood flow, especially in the smallest vessels that supply the legs and feet. Here's a way to picture it. Imagine a non-stick pan. When the pan's coating is intact, food slides easily. If that coating is damaged, food sticks and cooking becomes harder. The endothelium is like the pan's non-stick surface. Polyphenol-rich oils help preserve the coating, Oils high in fragile omega-3s do another job. They calm inflammation, almost like sending a team of janitors to remove the gunk that causes sticking. Both actions improve circulation. Now let me walk you through the practical side. Extra virgin olive oil is the hero. Buy a high-quality, cold-pressed, unrefined Evo in a dark glass bottle. Keep it cool and away from light. Use it raw on salads, vegetables, or simply take a tablespoon in the morning. If you prefer a gentler serving, a teaspoon daily can still be helpful. Consistency matters more than a large one-off dose. For cooking, use Evo at low to moderate temperatures. Its polyphenols are sensitive to high heat. When you cook at high temperatures, switch to a more heat-stable oil, like avocado oil. While Evo stands at the center, there are several companion oils that offer targeted benefits. I'll list each with a concise explanation and practical tips so you can adopt one or two into your routine without confusion. Sesame oil. This oil contains sesamin and sesamol, antioxidant compounds that support lipid stability. Sesame oil tolerates light cooking and adds a pleasant flavor. Recommended daily intake from clinical guidance I follow is about 1 to 2 tablespoons a day. Use it in dressings, lightly sauté vegetables, or drizzle it on steamed greens. If you're using it as a daily fat replacement for processed oils, aim to keep it within that 1–2 tablespoon range. Avocado oil. Avocado oil is rich in oleic acid, an omega-9 monounsaturated fat similar to Evo. It's more heat-stable than extra virgin olive oil, making it suitable for higher heat cooking while still supporting a healthy lipid profile. Use it for roasting or light frying when you want a neutral, cooking-friendly oil that still favors vascular health. Virgin coconut oil. Coconut brings medium-chain triglycerides, which are metabolized differently and can be used as a small supplemental energy source. That said, keep coconut oil modest. Around 1 teaspoon per day is the practical guidance I give. Use it as a flavoring or in small amounts in coffee or smoothies rather than as a primary cooking fat. Black garlic oil. This less common oil contains S-acetylcysteine and other sulfur compounds that can gently support vasodilation, meaning they help blood vessels relax a bit. Black garlic oil is best used raw. Add a splash to dressings, mashed vegetables, or a finishing drizzle. Think of it as a targeted circulatory aid rather than a main cooking oil. Flaxseed oil. Flax oil is concentrated in alpha-linolenic acid, a plant-based omega-3 that supports anti-inflammatory pathways. Important safety note: flaxseed oil is fragile and must be consumed cold. Do not heat it. Add it to smoothies, salads, or take it by the spoonful and store it refrigerated in a dark bottle. Because it oxidizes easily, keep portions small and use it up quickly after opening. Chia seed oil. Like flax, chia oil is rich in plant omega-3s and can complement Evo. One practical and well-tolerated routine is a simple morning combination. 1 teaspoon chia oil mixed with 1 teaspoon extra virgin olive oil in a small warm glass of water with a squeeze of lemon. This ritual, easy to swallow and gentle on digestion, combines the anti-inflammatory omega-3s with the vascular protective polyphenols from EVOO. It's the morning habit I've seen many patients adopt with good anecdotal results. A word on dosage and safety. The specific limits I recommend are conservative and based on what I use clinically. Sesame, 1 to 2 tablespoons per day. Virgin coconut oil, about 1 teaspoon per day. Chia, plus Evo. Morning ritual, 1 teaspoon chia oil, plus 1 teaspoon EVO. Flaxseed oil, always cold, small daily amounts. These oils support vascular function when used consistently and as part of a balanced diet, but they don't replace prescribed medication. If you are on anticoagulants, antiplatelet medications, or have a complex cardiovascular condition, talk with your physician before starting a new oil regimen, especially if you intend to take concentrated oil supplements. Let me give you a short, representative example from my practice, one I share not as a guarantee, but to illustrate how small changes can play out. A patient in his early 70s, who I'll call Mr. H, had long-standing cold feet and short walks before his calves tightened. He took his medications, exercised intermittently, and had a kitchen full of processed oils. We switched his daily cooking and finishing oil to a high-quality extra virgin olive oil, added a tablespoon of sesame oil at lunchtime as a dressing, and introduced a morning ritual of 1 teaspoon chia oil plus 1 teaspoon Evo in water. He kept weight-bearing walks gentle but consistent. Within 3 weeks, he reported warmer toes, less calf heaviness, and he could walk the local park bench to bench without stopping. Again, this is anecdotal, but it's the kind of change I see repeatedly when diet and targeted oils are corrected alongside medical care. If you try the morning Chia Sevu ritual, here's what to expect in the short term. In the first week, you may notice subtle improvements, slightly warmer hands and feet, a small boost in energy, or less stiffness after sitting. These early signs reflect reduced vascular irritation and improved microcirculation. Over a few weeks, many people report being able to walk farther or stand with less dizziness. Keep in mind that everyone responds differently. Factors like baseline diet, degree of vascular disease, medications, and activity level all matter. The point is to watch for small, measurable changes rather than expecting immediate miracles. Storage and handling are crucial, often as important as which oil you choose. Oils degrade with exposure to heat, light, and air. Always buy oils in dark glass bottles when possible. Keep them in a cool, dark cupboard away from the stove. For fragile oils like flaxseed and chia, store them in the refrigerator after opening and use them quickly. Avoid buying large quantities you won't finish within a few months, because oxidation reduces the protective compounds and can make oils inflammatory rather than protective. When you see terms like light or refined on a label, that usually means the oil has been processed with heat or chemicals, which strips out the beneficial polyphenols. Choose cold-pressed and unrefined when you can. There are also oils and practices to avoid. Industrial, highly refined vegetable oils, soybean, canola, corn, and cottonseed are pervasive in processed foods and many commercial frying oils. They tend to be high in omega-6 polyunsaturated fats in forms that can promote inflammation when consumed in excess relative to omega-3s. Avoid reheated frying oils and repeatedly used deep fryer oils. Reheating creates oxidation products and trans-type compounds that stress vessels. If you're at the grocery store, become label conscious, prefer single-ingredient oils, cold-pressed, unrefined, and check packaging. Dark glass is a good sign. In the kitchen, match the oil to the job. For salads, finishing, and raw uses, Evo is ideal. For higher heat cooking, choose avocado oil. For small supplemental uses or flavor accents, sesame or black garlic oil provide additional antioxidants and flavor. Use virgin coconut sparingly as a supplemental energy source. Reserve flaxseed and chia oils for cold consumption or for mixing with Evo in morning rituals. If you're wondering how to start without overwhelming yourself, pick one approach and commit for 7 days. My single simplest recommendation: swap your usual spread or salad dressing for extra virgin olive oil and add the morning 1 TSP chia plus 1 TSP Evo ritual if you don't have contraindications. Pay attention to 3 simple markers: warmth in your hands and feet, heaviness in the legs during the day, and how far you can walk before needing to stop. Track them in a notebook or on your phone. Small, consistent habits are what build measurable change. A brief safety reminder: oils are supportive nutritional tools, not substitutes for prescribed therapies. If you are on blood-thinning medications, have a diagnosis of advanced cardiovascular disease, or are undergoing treatment that could interact with dietary changes, consult your physician before starting any concentrated oil regimen. Do not stop or change prescribed medicines without medical advice. To wrap up, extra virgin olive oil is the secret many seniors swear by because it combines polyphenols that protect vessels with a pleasant, easy-to-use format. Drizzle, spoonful, and habit. Complement it with sesame, avocado, coconut, sparingly, black garlic, flax, and chia oils as needed for flavor and targeted mechanisms. Mind storage, avoid refined industrial oils and reheated frying oils, and adopt a small daily ritual like the 1 TSP Chia plus 1 TSP Evo in warm water with lemon to begin. Now the practical part. Choose one oil today, Evo is my top pick, and commit to using it properly for the next 7 days. Notice any change in warmth, leg stamina, or energy. Come back and tell us in the comments your age and country and what you observed. If you're new here, please like and subscribe for more practical advice on healthy aging. If you're on medications or have complex heart conditions, contact your healthcare provider before starting this routine. You don't have to overhaul your life to support healthier circulation. Small, repeatable kitchen choices add up. Start with extra virgin olive oil as your daily ally. Protect it from heat and light. Pair it with one supportive oil that fits your needs, and watch for gentle improvements. Try it for 1 week and let us know how your legs and energy feel.